Today in this video, I'm going to talk about prioritization, which is who to see first. Prioritization is the most asked question in the Nclex exam. So, when patient comes to emergency department, who we have to see or assess first? We all know about the ABC rule, which is airway, breathing, circulation comes first in the priority. Example, in circulatory, patient complain of calf pain, which indicate patient is having deep vein thrombosis. So we have to always assess those patients first. If the patient is not having any of the above mentioned problem like airway, breathing, circulation, then we have to look for mental status changes, which can be a stupor, delirium, or unresolved medical issue, or any abnormal lab value, which can be potassium lab value, calcium lab value, and these are the second high risk priority and risk to see in the emergency department. So if patient doesn't come with the ABC problem, we have to look for mental status changes, whether patient is stupor, delirium, or any having unresolved medical issue, whichever medical issue which has not been resolved, or any acute pain. In Nclex, always look for acute pain, not chronic pain. So acute pain, we have to look for abnormal lab value, which can be any of the lab value according to the patient's status of condition. These are the second high risk priority and risks to see in the emergency department. In which all condition we have to assess first. Some example are these all examples are very frequently asked in the Nclex exam, which is first in airway, which is accidental dislodgement of a tube of a fresh tracheostomy tube is always considered a medical emergency. Fresh tracheostomy tube is less than 1 week. So this is medical emergency. First thing we have to do is pull the retention suture apart if present. If any retention suture is kept in the fresh tracheostomy tube, so we have to pull that retention suture apart. Then if not present, we have to insert a curved hemostat to hold stoma, that is the opening, artificial opening, if suture are absent. If sutures are absent, we have to insert a curved hemostat to hold the stoma open. So if any desaturation persists, we should apply a sterile occlusive dressing over the stoma and ventilate a client with a bag and valve mask over the nose and mouth. So next example is if any patients come in emergency department with chest wound, that is sucking chest wound, which can be due to a trauma, fall, accident, or gunshots, which is open, that indicate that there will be an open pneumothorax, which is pneumothorax means air into the thorax. It is considered a medical emergency. In sucking chest wound, what happens is air is sucked into the thoracic cavity through the opening, through the chest wall, instead of into the lungs through the airways. So what happens is normally in normal person, we inhale through the nose, but due to the presence of wound in the chest wall, air is directly sucked into the pleural cavity, which can cause open pneumothorax, which may eventually, if not treated, may collapse the lungs and patient may die. So this is also considered a medical emergency. So next example is if any patient comes in emergency department with pain in the scrotal region and the swelling will be there, which indicate there is a testicular torsion and can lead to testicular ischemia and necrosis if not treated on time. This example is a circulatory problem, which is the first priority to see. If not treated, this leads to necrosis of the testis and the gland will be destroyed and the changes will be not reversible. So this problem is the highest priority need, and in this Next example is if any client taking sildenafil, that is Viagra. This medication used to treat the erectile dysfunction and also treat pulmonary arterial hypertension. Or if the client is taking tablet trazodone, which is antidepressant, if this patient complains of prolonged painful erection more than 2 hours, this condition is known as priapism, which is caused by trapping of blood in the penile vasculature and can lead to erectile tissue hypoxia and necrosis. This is always considered a medical emergency. If this patient, those patient who is taking sildenafil or tablet trazodone, please look for this side effect, which if not treated can have a irreversible damage to the testis. Next example is if any client with closed head injury with other medical disorder. If a client comes with a closed head injury in the emergency department accompanying with a medical disorder which such as atrial fibrillation, is considered a life-threatening, as in atrial fibrillation patient takes anticoagulant which can be a warfarin, apixaban, rivaroxaban, dabigatran, which makes life-threatening intracranial bleed. So those patients with closed head injury with other medical disorders, especially atrial fibrillation, is considered life-threatening, which may lead to threatening intracranial bleed. Next example is if a patient have wrist contracture. Contracture is a permanent shortening of a muscle or a joint, and patient having inability to extend his finger. This condition is called VOLKMANN contracture. So it occurs as a result of compartment syndrome associated with the distal humerus fracture. So this condition, VOLKMANN contracture, occurs only in the distal humerus fracture. Humerus is a bone of an arm. So a patient with a humerus fracture, we have to look for this complication. It's a medical emergency that can cause permanent damage if untreated. So we have to remove the restrictive dressing as soon as possible. And contact the HCP so that the fasciotomy, a surgical procedure where the fascia is cut to relieve the tension or pressure, commonly to treat the resulting loss of circulation to an area of tissue. A client with a cancer who experience a new unexpected neurologic complication is the priority. So any patient with a cancer who experience a new onset. In Nclex, mainly we have to look for a new onset of symptoms, especially with the cancer. This indicates the patient is having a complication from the cancer, and it is a priority based question. Example is acute symptom of spinal cord compression are most priority. In this, the central nervous system and the peripheral nervous system are very susceptible to cancer and its treatment. The commonest of these complications are radiation-induced injury to the brain, spine, and peripheral nerves, and the chemotherapy-induced peripheral neuropathy. So this is very important in cancer patient who experience a new onset of a neurologic complication is the most priority one to look for. So next example is if any client, especially children's, come in emergency department with restlessness, anxious, drooling, and assume a tripod position. A tripod position is a position when the child is in upright position, leaning forward with chin and tongue sticking out. So this is called a tripod position. This is a medical emergency condition which is epiglottitis. In epiglottitis, there are main 4 symptoms, which is 4D. This 4D is mnemonic, which will assist in remembering. 1D stands for dysphonia. Dysphonia is an impairment or change in the voice quality that affect the ability to speak or sing. And second D is dysphagia, difficulty in swallowing. And third is drooling, the flow of saliva outside the mouth. And last D is distress, that is respiratory distress. And this, if any patient comes with epiglottitis in emergency department, we have to avoid throat inspection until the intubation stats are readily available. Next example is rhabdomyolysis. This is a medical emergency caused by a muscle injury that releases the myoglobin into the bloodstreams, which is myoglobin is a protein, can lead to a kidney damage. So priority is to preserve the kidney function by administering large amount of IV fluid that will be a normal saline. This myoglobin is a proteinous in nature, so will clog the kidney tubes, leading to a kidney failure if not treated on time. So this rhabdomyolysis can be caused by an injury to a muscle, or can be caused by a medication, which is use of statin medication, which is an anti-lipid, which helps in lowering cholesterol. Those patients who is taking statin medication, the statin medication are atorvastatin, simvastatin, rosuvastatin. So those patients who is taking this medication, if they complain of pain, muscle pain, we have to look for this complication and assess the patient first. And next example is if a client complains of headache that he described as worst headache of his life. This indicates a leakage of aneurysm. Aneurysm is mainly a ballooning or weakened area in the artery. So if a patient complains of a headache which he described as a worst headache of his life, this indicates a leakage of aneurysm, which may cause, if not treated, causing a stroke or death. So aneurysm can be in the brain or can be in the abdominal. So any kind of aneurysm, which if patient complain of severe pain or in abdomen severe ripping pain, back pain, this indicate there is a leakage of aneurysm. So if patient describe a headache, worst headache of his life, it indicate a leakage of aneurysm, and we have to look this patient first among all the other priority. So next example is if patients enter emergency department and has a burn over his face, chest or neck, and singed, that patient is having a singed nasal hair or having a hoarseness of voice. These all are the symptom of inhalation injury during the burn. So this case has to be assessed always first in the emergency department, because if any delay occur, there will be a swelling in the region of burn, especially neck, and this will lead to an airway edema, and patient will have an airway problem and will have a respiratory failure. So in Nclex, we have to look for if any patient with a burn, if there's any burn caution, we have to look for this singed nasal hair. If there is a singed nasal hair or hoarseness of voice, this all indicate the patient is having a respiratory problem, will eventually have a respiratory failure, will have a respiratory problem or respiratory failure if not treated first. So next example is a patient with a fractured femur. If any patient with a fractured femur comes in emergency department or maybe outside in the disaster area, we always have to look those patients first, assess those patients first, because this is a life-threatening condition. As in the femur, there is a fatty tissue, bone marrow, which can get into the bloodstreams and cause a blood clot. So we can imagine that if any fatty tissue or bone marrow materials get mixed up with the blood, which will clot the blood eventually, and this can be a life-threatening condition. So as the femur is the longest and strongest bone, contain bone marrow blood vessel, so we have to always check those patients first. So this is the end of today's video. Thanks for watching, and subscribe for more future video, and share and like.